Hi, I recently had mitral valve repair surgery with Rashmi Yadav, recommended by my cardiologist, Dr. Lyon. I first met Rashmi at the Royal Brompton Hospital, um, and she was immediately reassuring, incredibly knowledgeable, and ran through the various options for surgery, which she hoped would be a repair rather than a replacement. I had a number of questions which she responded to very thoroughly and put me totally at ease. So I felt like I was in the best possible hands. And then knowing her success rate in performing this surgery, which I think is virtually 100%, obviously completely trusted her and the recommended approach. So I think the next step was having a TOE, which is a scan of the heart. It's a small procedure under general anaesthetic, but a quick one where I think they put a tube down your throat to give a clearer picture of the heart. And that showed, when I had a follow-up consultation, that repair should be, I think, 90% possible. In my case, it also alerted her to the fact that I have a scoliosis, a curved spine, which meant that the more minimally invasive approach would be riskier. So I think, having talked through the options with her on a follow-up Zoom, we decided that the open heart sternotomy approach would be the one to go for. Obviously, we talked it through at length because it's a procedure that takes longer to recover from, and is a bigger operation. But I completely trusted her judgment, and actually hearing that the surgery takes less time and it is simpler for the surgeon than the keyhole was also, I suppose, reassuring. But Rashmi always was incredibly attentive and informative, and yeah, I did feel like I was in the very best hands. The sternotomy approach did mean that it would be 3 months before I was back at work and back to a normal routine, as opposed to, I think, 6 to 8 weeks for keyhole. But I think she reiterated that because I was relatively young, I would make a full and speedy recovery. The surgery went well, and the valve was repaired without any issue. It was leaking quite a lot before, and that the surgery had eliminated any further leaks. So I think it was a 4-5 hour operation, and I was in the Royal Brompton for 5 days afterwards. I will say the first few days after surgery were the toughest in terms of pain management, and just just kind of getting used to everything. But then it did ease up, and I will say that the nurses at the Royal Brompton were all terrific, and Rashmi checked in regularly, came to see me while I was there, and again, I think her incredibly calm, reassuring presence was very helpful and appreciated. After the operation, I did have some bouts of atrial fibrillation, which can happen in, I think, 1 in 5 patients. So I was ended up being readmitted for a night, and my medication changed, but Rashmi consulted with my cardiologist and very much on the case. And I'm now almost 2 months post-surgery. It's all going well. I would say it takes time, and it's worth going into it being patient and making sure that you do take the time to properly recover. I think the first few weeks definitely needed to embrace feeling quite tired, just going for short strolls, but yeah, confident I'll be back to full health in before too long. And I had wonderful care under Rashmi Yadav. She's always personable, felt like she really did care, and I couldn't recommend her more. Certainly for valve surgery, I don't think you'd find someone better. So yes.